Hi guys, I'm just here with some tips for the Mrcs exam. So some common mistakes that persons do when preparing for the MRCS exam is that they prepare the most rare presentations that you would come across in surgery. The MRCS exam is created for core surgical trainees to enter higher surgical training. Now that means that you have to master the basics. Not saying that you're not supposed to know the rare stuff, but if you're going to go into the exam learning things like rare syndromes, it's not really going to like Mittelschmerz or something, just something that you don't see very often. You're not going to ace the exam as or do as well as you would think. In my exam, very common things came, even down to anatomy. They didn't ask me like, oh, what's the blood supply of the anterior part of the brain just inferior to the front of no. Simple things. They asked me triangles of the neck, anterior and posterior triangles of the neck, insertion, embryological origin and insertion of the muscles of the anterior compartment of the thigh, origin of the muscles of the posterior compartment of the thigh. They ask you things like that. Ask you things like what happens if you get a mid-shaft femoral fracture or distal radial fracture or radius fracture, sorry. What about a blowout fracture of the orbit? What happens if you get raccoon eyes, after trauma? Things like that. There's some topics that are very, very, very common and very commonly tested that you should know for like the back of your hand. Hernias. If you're a surgeon and you don't know hernias, that's a problem. Acute cholecystitis, appendicitis, intestinal obstruction, acute abdomen. These are things that you as a surgical doctor should know. You should know how to recognize an acute abdomen. I think in my exam, maybe 2 stations they dealt directly with an acute abdomen. Diverticulitis, acute diverticular bleed, PR bleed, how to manage PR bleed, scrotal swellings. You have to know the differential diagnosis about scrotal swelling. These are basic but very important stations that you have to be able to master. Now, one of my stations that I actually did not even remember about it, like remember the topic, but for some reason, because I had done it before as a medical student, I was able to, I think I did pretty well on that station, which came my second part of my exam, which was examination of a scrotum. This patient had a hydrocele. Now, as you know, hydrocele comes in two types: is communicating, non-communicating. But in the exam, I didn't remember initially, but the examiner was so mannerly that what he did was he allowed me to examine the patient, come up with the diagnosis, management of the patient, and then he asked me the different types because he had asked initially, like at the beginning of the examination, but I didn't remember. So when he asked me at the end, so yes, do you remember what the different types of hydrocele? What are the different types of hydrocele? And I was able to answer. So because I learned it well as a medical student, I was able to then translate this into the postgraduate exam. And that's just how you have to go about your learning. Learn stuff really well initially, because you never know when it's going to be. You're going to have to delve into your memory from the back, from the far depths of your memory to pull a topic that you had read maybe three years ago. Because the last time I saw hydrocele would have been when I was a medical student. I was a medical student in 2000 and, well, I finished medical school in 2013. So you kind of understand how far ago I actually read that topic. So these are things you have to keep in mind. Something that they actually might throw at you too: management of peripheral vascular disease. That came as a station, but people think that it's just a rattling off a whole list of things that you would do and manage for this patient. No, that's not it. You have to take a history, detailed history. You have to get the salient points: smoking history, cholesterol, history of hypertension, history of previous admissions for pain, rest pain, intermittent claudication, changes in the color of the foot, family history, because you want enough to have history of familial hypercholesteremia, those kind of things. So you have to take a detailed history. And one thing I know, well, I figure that a lot of these examiners are looking for, especially in first world countries like the UK and the US, they don't just want to know that you can ask a question. They want to know that you can relate to the patient in a way that they can respond and understand what you're saying. The patients are actors, some of them, but even though they're actors, they still know how to respond in a way that, because they already know the case that they're going to be are quizzed upon, right? So when you go and you start to question them about a particular disease, and you don't relay the information to them correctly, you're not going to answer. Same thing in the Breaking Bad station. I actually thought I failed that station because the patient never got cam. But that's the thing. They're not supposed to get cam. They're supposed to be irate. And as the Breaking Bad station progresses, even though they are irate, how you handle that situation, whether it be being soft spoken, empathetic to the patient, to the patient's needs. Those are things that the examiner is looking for. Don't just go and say, well, that's how life is. You're gonna die. Boom. Or even just be stoic and say exactly what the textbook says to say. No. If you have to act it. Say, well, we're very sorry that we have to. For instance, the patient said they had the case was that you had lost the blood sample, and the patient is afraid of needles. So this is not my case, but this is something that comes pretty often. And you have to retake the sample, and the patient's afraid of needles. So what are you going to tell the patient? And you have to be empathetic to the patient's fears, because people are genuinely afraid of needles. Things like that. As I remember more tips, I'll share them with you. But just continue to study hard, guys, and look out for another video.